My name is Dr. Vincent Okungu. I'm a full-time lecturer at the Strathmore Business School, specifically at the Institute for Healthcare Management. If you look at the contributory system, we have to look at the kind of population that we have. Majority of our population is in the informal sector, which favors a non-contributory system. But what we are exploring now is a contributory system to financing universal health coverage. The contributory system lays more emphasis where labor is formal. Our labor is not formal. So we're kind of taking a wrong approach to universal health coverage. But having said that, our health system is very reliant on donor funding and also out-of-pocket funding. These are not sustainable financing strategies. The best option is to find out how we can develop domestic funding strategies. And first of all, we'll have to look at where is government spending most of its money, and then try to reprioritize the health sector in government spending. Because as we speak, if you look at the trend in health sector funding, it's been more or less constant at the same level. It has never gone up. So the government needs to more than triple its current funding of the health system to raise more funds to be able to finance universal health coverage. The second thing is to look at the fiscal space. How can the tax system be made more efficient? How can we minimize capital flight? And where else can we develop dedicated taxes for healthcare? Because currently what we have is just premium contribution as a dedicated tax to the health system, for prepaid healthcare. But we need to think more about how to develop more dedicated taxes for healthcare and raise funds to raise domestic funds to sustainably finance universal health coverage. The other thing I would want to mention is that the government needs to honor its commitments to the Abuja target that allocated 15% of national budget to healthcare. A recent study by a group of us indicated that if the government could honor the Abuja target, that would be enough to finance universal health coverage in Kenya. You talked about prepaying for healthcare. That is, paying for a service before, health insurance. And the question is towards equitable health funding and equitable receipt of services, equitable benefit of service, equitable funding, equitable benefit. It's not easy to achieve, but one of the best ways to achieve this is prepaying for healthcare. So you identify who pays and who benefits. Not everybody can afford, but everybody should benefit according to need. So if there is a poor person somewhere who is very sick, they should be paid for by a rich person somewhere who may not need this service. So it's a question of identifying who pays for these services and who benefits. And the best strategy is a prepaid system. And in our context, in our Kenyan context, the best prepaid system that will make services equitable is tax funded. And what we need to think about is, where is this money going to come from? So we need to think to be more innovative, as I mentioned, looking at areas where we can dedicate more money. We can explore dedicated taxes for healthcare. We can look at companies that can be taxed to put money directly into healthcare. Products such as tobacco, alcohol that can be taxed to put money into the health system. And there are very many ways of dedicating taxes to healthcare. A lot of countries have done it. Ghana has done it. Gabon has done it. Thailand has done it. Sri Lanka has done it. And these are countries that are middle-income countries. like us. So there's no question of saying, oh no, the tax base is so small. Expand it. Look at ways of expanding it, because it can be expanded. Look at indirect methods of taxation to get resources from the informal sector, because it's so huge and you can't directly tax the informal sector because you can't identify their income. So you have to look at modes of indirect taxation that will target the informal sector and raise this money and put it into healthcare to fund universal health coverage.